As far as presentations go, our health director, David Knopf, and I, as you know, have been working on the response to the novel coronavirus known as COVID-19. So I'm going to give you a little bit of an update right now, so we'll just consider this his presentation and my first Selectmen's report all in one. So today we had a statewide conference call at 5 p.m. with all of the agencies of cognizance, Department of Emergency Management and Homeland Security, Department of Public Health, who is the lead agency on the virus epidemic, the governor, it was his conference call today, the Commissioner of Education, the Commissioner of the Department of Emergency Response and Security, the Office of Early Childhood Education, and OSHA. The situation today is that 56 people in the state of Connecticut have been tested for the coronavirus. The criteria for testing remains very stringent. You must be either sick and in the hospital, or having traveled to an area of geographic concern, or in face-to-face contact with somebody that has a positive test for the coronavirus, or your physician, by virtue of your immune-compromised state, underlying health issues, or your age, recommends, because you have all the symptoms that might suggest you have the coronavirus, that you be tested. The state of Connecticut right now has 2 testing kits. Each kit can test 600 people. So 1,200 people in total. It's not very many tests in relation to the number of people, 3.5 million people that live in the state of Connecticut. This week, private agencies, LabCorp and Quest Diagnostics, are beginning to open up their commercial testing for the coronavirus. Once more of these private agencies are online to test, physicians will have more capability of authorizing tests to occur. Right now, all of the testing is happening through the State of Connecticut Department of Public Health. We consider the virus outbreak to be emerging in communities around us. There are incidents of outbreaks in Westchester, in Rhode Island, in Massachusetts. So my message tonight to everyone is the coronavirus is here. It very well could have been here for quite a while. 80% of the people that contract the coronavirus get very mild, sometimes no symptoms, but they remain a carrier and a transmitter for the coronavirus. Children in particular seem to be, thankfully, individuals who have very limited symptoms of the coronavirus, but they can transmit the virus to adults, and of concern would be to the elderly and to people who have immune-compromised systems. And what I mean by underlying health issues are diabetes, heart health issues, kidney issues, lung issues, and anybody that's taking immune-suppressing medications. So we are particularly mindful of our assisted living communities here in the town of Darien, and our local public health agency has been in contact with those private business entities to make sure that they're following all appropriate and enhanced protocols for screening the folks that come in to visit, and all of their cleaning and disinfecting protocols. New guidance today by the governor. I do want to say that the governor has not issued a public health emergency for the state of Connecticut at this time. Because the issue is emerging, things do happen hourly. But in spite of the fact of not issuing a public health emergency, they are strongly recommending that people do not meet in large groups of 100 or more members where you would be in close proximity to one another. The objective is to try and slow the process of the social transmission of the coronavirus. So that has implications, obviously, for many local agencies, even for our own RTM. What does that mean? We cannot compel government at this point, because there's no declaration, we cannot mandate that you don't meet in large groups, but we're encouraging all local agencies to use their best judgment if those gatherings are non-essential, to consider changing the date or canceling those. For travel advice, I recommend highly that you look at the CDC website. cdc.gov has a tremendous sum of information on all aspects of the coronavirus, from how it started in Wuhan, China, the end of December, to travel advisories, and to be particularly mindful of the places across the world that are at a level 3 travel advisory. That includes China, certainly, Italy, Iran, South Korea. And we heard this afternoon that the Italian government has essentially quarantined the entire country of Italy, which is kind of unprecedented. But everybody's working very hard to try and stem the transmission of this disease. We're hoping that those measures are not required here in the United States. We generally have excellent public health protocols here. And I think that if each and every one of us does our own personal part to make sure that we are enhancing our personal health hygiene and not unnecessarily exposing ourselves or the people that we love and care about to illness, that would be great. The coronavirus situation is exacerbated at this time because it's also flu season. And there's been information traveling in the community about someone knowing that someone was tested for the coronavirus. And what I want to say explicitly is local government would not be notified if someone were tested for the coronavirus. Our local health department would be notified if there were a test that was positive, because it becomes the responsibility of local health department to actually monitor the quarantine of any individual that tests positive for the coronavirus. But you may hear that people are being tested because they're sick, and that's true. Folks who are sick, who have flu-like symptoms, are being tested for all other strains of flus and illnesses to rule those out before they're recommended for testing for the coronavirus. That may change as more testing capabilities come online, but that's the process and protocol right now. The World Health Organization, WHO.int, also has a substantive amount of information on their website. We have information on the town website. You can access it by the homepage. The Public Health Department has information on their part of the town website. You might also hear that there are a number of colleges and universities in our general metropolitan region, including in Connecticut, Sacred Heart University and several universities in New York City, that are going to stop offering in-person classes and go to an e-learning scenario. That may also happen with our public school agencies. Those decisions are made at the local level. So we are in contact every day. Our emergency management team and myself are in communication every day with the superintendent of schools to make sure that we're on top of that issue as the need arises. There's a host of other issues that are related to business continuity for, obviously, businesses and local partners, but here for municipal government. And we've been working with Kate and our other town employees to work on plans for business continuity. We're a public-facing agency. We have to be available to you to provide the services that you need, but also be in a position to make sure that we're protecting our staff and the public from any of us that might get sick. And in return, we ask that if you're sick, you stay home. And hopefully, if there's a town service that you need, call ahead if you're sick, and hopefully we can help figure out how to take care of those needs that you have without you coming in and exposing the general public and town staff with sickness. And the stay home if you're sick advice really applies to all of your daily activities. You might feel that you're generally well enough to go along with your daily routine, but remember, that person that you come in contact with at the grocery store or in the library might have a compromised immune system, and you don't want to risk getting them sick unnecessarily. So err on the side of caution and stay home if you're sick. The one thing I do want to caution is that don't be afraid to reach out to your healthcare providers if you're not feeling well, either from flu-like symptoms or other sicknesses. We don't want, fear of going to the doctor's office or the hospital to cause you to not seek the care that you need. But it's important that you call ahead. If you're not feeling well, call your doctor. They may have different protocols for you to be able to be evaluated by their staff. So don't expose yourself or anyone else unnecessarily by just showing up at a doctor's office or at an emergency room at a hospital. That would be very helpful to the general public. With that, I think that's the high-level update as of today, but I will entertain questions from the board on the virus.
Thank you very much. Very thorough.
Okay. Great, thank you. And I will keep everyone updated as needed, for sure.